Youth justice workers in WA have called for systemic changes in the prison system to prevent further suicides of children or teenagers in custody. A 17-year-old boy took his own life last week, 2 days after he'd been sent to the Banksia Hill Detention Centre for Children. His death has put the spotlight back on the state's youth justice system and raised questions about the level of support for children in custody. Jerry Georgatos is a youth justice expert in Western Australia and suicide prevention advocate, and he knew the boy involved and his family, and he joins me now. Jerry, thank you for your time this morning.
Morning, Stephen. Thank you.
What can you tell us about the teenager involved in this tragic case?
Well, there's only so much I can talk about background because of the legal prohibitions about talking of children less than 18 years of age. But he was in the care of child protection from the age of 9 months old. He was taken into care at 9 months old, and he was under orders till 18 years of age, which he didn't reach, sadly, tragically. He was chronically in juvenile detention, which is a child's prison. And it's anomalous to call it juvenile detention. They are sentenced, many of them, and others are actually remanded for extenuating periods. He was in and out right throughout his teen years. He had severe ADHD, I can say that, and he needed specialist needs support. He didn't always get that when in juvenile detention, but he was in the care of the state, not in the care of his biological parents. His parents are grieving. It was prefaced that I knew his parents. I didn't actually know his parents, but I knew of the boy.
Why? Sorry about that, Jerry. Why was this boy in custody?
Well, he was failed throughout his life, in my view, by the state, which is overwhelmed with the number of children they're taking into care. It's been said also that he was a First Nations child. He wasn't First Nations. He was actually a non-Indigenous boy, non-First Nations. But it also goes to the heart of the major issue of what's actually wrong with juvenile justice in children's prisons. It isn't if I may say colloquially, a black problem, a brown problem, or a white problem. The carceral estate is the problem. Juvenile detention is the problem. It's a systemic problem. But why he was inside, I can't speak to. Even though I do know why he was inside, it was disordered thinking. It was not being supported, not being nurtured, not having the one-on-one care that he should have had while on the outside. But last year, there was a period of respite where he was 9 months in a facility that was communal living by a mob called Plan and Grow, who, in the eyes of the government, were quite costly. In those 9 months, he was supported and assisted in his living in general excellently, and he didn't offend in any way whatsoever. So when he had his vulnerabilities, his low moments, he had the one-on-one nurture. That program was defunded by the government because it was considered too costly, but it's cost his life since, because once he didn't have the residential care of that one-on-one support from that program, he lapsed and he had no support whatsoever because capability wasn't funded, and there should be questions asked in terms of accountability why that program was defunded and why would you, and when there were no other alternatives.
Why was that program defunded if it was being so successful?
Too costly is my understanding, and I have that on, it was far too costly. But what cost does it matter in the immediate when you have to look at the social return? The social return is reducing offending. The social return is community safety, community reckoning. The social return is not having what actually does happen. That 70% of children in juvenile detention in general right throughout the country, but also even higher than that in Western Australia, go on to adult incarceration once they turn 18, 19 or 20. And we've also got to remember that despite the fact that numbers have released have reduced, in terms of the young people, children aged from 10 to 17 years of age in Banksia Hill, from at one stage 150 to 120, and earlier in the year 70 odd to now 60. It's an arrest and release culture. The courts are averse to actually turning kids towards Banksia Hill, which is not a place that's rehabilitative, restorative, or life transformative, but actually quite damning and quite damaging. And there's also kids on orders, community orders, approaching about 2,000 children annually, and at any one time 1,000 children on orders, on community orders, who have failed and who often breach many times and are left unsupported. So it's a release and non-support culture. So we've got an arrest and release culture, and there's no release and support.
On Radio National Breakfast, it's 12 minutes past 8, and we're talking to Jerry Georgatos, a youth justice expert and advocate in Western Australia. Jerry, apparently children in prisons like Banksia Hill are not eligible for Medicare. What happens to children like this teenager if they harm themselves or attempt suicide?
Well, it's an abomination that the only exception to Medicare in this country, it's reprehensible. It is an abomination that people who are incarcerated who need it most have no access to Medicare to actually ensure that they've got an equivalency of health services, primary health, secondary health, and ancillary health, mental health, while they're incarcerated. That's all adult prisons. That's all 117 adult prisons. That's all 17 juvenile detention facilities across the country. It's just an abomination. That's health discrimination, and they're coming out often worse than what they went in terms of their health care. And a lot of the suicidality in adult prisons and juvenile detention facilities is attributed to is directly correlated to the fact that there's this health discrimination, this health disparity. So they're not getting seen by mental health practitioners, by general practitioners, physicians, or the like. And for serious, I could go on about all sorts of stories, but what it's like for children, in effect, it's in a country such as us, where we actually budget healthcare and facilities and don't spend beyond that. And it isn't equivalent to what's on the outside.
Jerry, before I let you go, I just want to ask you what needs to change.
What needs to change is healthcare can actually be Medicare provided by the stroke of a pen by the Minister for Health in 2 seconds flat. It doesn't need the guarantee of legislation for perpetuity. That can come afterwards. So that can change straight away. The federal government can intervene, and the Prime Minister Anthony Albanese and the Health Minister can make that difference. What needs to change is the infrastructure of juvenile detention facilities where children have to be held into secure psychosocial circumstance. Needs to be age tiered, needs to be age bracketed. 10, 11-year-olds should not be with 16 and 17-year-olds. We need nurturers on a one-on-one basis in there with seasoned expertise, with qualifications and the like, that which doesn't happen at all. We need restorative, rehabilitative, and life transformative programs like the Nordic countries actually have. And we have none of that in this country whatsoever. We certainly have none of that in Banksia Hill. I can sum it all up that there is nothing restorative, nothing rehabilitative, nothing redemptive. All these words that are used, actually they have rehabilitation and all sorts of programs, activity-based programs. They're not life transformative programs, and it's an abomination that this is actually the case. We have the capacity and the affluence in this country to actually create an equivalency of community living inside facilities that are demographically based, so they're also close to all their various connections, all their various pathways to opportunity, and we have none of that in this country. And it's the advocacy and the narratives have to start changing to actually articulate the real solutions and the authentic ways forward to changing these lives. Otherwise, as I said, 70% of these children will go into adult incarceration. And it's not just that we're losing to the tragedy of children to suicide. Post-release, in the first year post-release, there have been more than 100 suicides of young people in post-custody. that have come out of Banksia with the horizon bleak for them, and that's over the last 20 years. And we've had 18, now 19 deaths in juvenile detention facilities in this country over the last 30 years. And it's not just the suicidality, it's the broken minds and the broken lives.
Jerry, we thank you for talking to us this morning.
Thank you, Stephen, and best wishes to everybody. And everybody should get on the public consciousness bandwagon and shift for change.
Thank you, Jerry Georgiadis, a youth justice expert.